The frontal bone composes the majority of the anterior view of the cranium. It is a single bone, although it forms in fetuses as a pair of bones which fuse. There is a frontal suture which closes during the first year of life, and remnants of this suture are visible in a small percentage of adults. Given that the frontal bone helps to enclose the cranial cavity of the brain, the expansion of the frontal bone and the change in its shape has therefore mirrored the expansion of the brain in mammals, in primates, in higher primates, in hominids, and ultimately in humans. Just inside the frontal bone is the prefrontal cortex of the brain, where much of the brain's higher functioning is organized. And so thus the change in the shape of the frontal bone of hominids to allow the forehead in our species, typical of Homo sapiens, but not of other species of the genus Homo, was probably significant in reflecting reorganization of the brain. The frontal bone helps to compose the superior border of the orbit for the eye, and also the superior portion of part of the nasal cavity. The frontal bone in primates and a few other groups of mammals helped to protect the eye laterally, forming a postorbital bar with the zygomatic bone. This is significant in primates and one of the defining features of primates, given the growing importance of eyes in this group. Skull bones can vary in size, in shape, and in other ways. So, for example, the small opening, the supraorbital foramen in the frontal bone, which lets an artery and nerve pass to the forehead, in many individuals is not a complete hole or foramen, but rather a notch. The frontal bone is one of 4 bones of the skull which possesses a space known as a sinus. The frontal sinus is not present at birth or in the first years of life. It becomes functional in late childhood and reaches its maximum size after puberty, holding about 4 to 7 milliliters in adults. The frontal sinus drains into the nasal cavity through the frontonasal duct. Its drainage is the most complex and most variable of all of the sinuses which drain into the nasal cavity. Like all sinuses, it probably has multiple roles, such as making skull bones lighter, serving as a resonance chamber for speech in the same way that, say, the box of the guitar and its hollow space helps to resonate the sound by the vibrating strings. The mucus produced in the sinuses helps to warm and humidify the air of the nasal cavity and helps to trap microbes, dust, smoke particles, and debris, which then protects the lungs. These spaces can also protect the skull from facial trauma and perhaps even the temperature changes in the nasal cavity. About 5% of adults lack a frontal sinus, and the problems of chronic sinusitis can be worsened given how close the frontal sinus is to the orbits and the eyes, and then also the brain. For example, this increases the risk of meningitis.